As the new year approaches, panic is setting in for some of Washington's most vulnerable. Those who are low income and disabled will have to live without several health services currently provided under Medicaid. The cuts take an $80 million chunk out of the state's $4.6 billion budget shortfall. There's a lot of confusion and misunderstanding about the cuts. So we turn to KXLY4 Sally Showman, who has a reality check on which programs are impacted. Sally?
Robin, at the beginning of December, the state sent a letter out notifying people impacted by the Medicaid cuts, but the letter did not list a phone number or web address for folks to turn to with questions. So we're going to clear up some of the confusion and break down the programs that will be eliminated within the first 2 months of the year.
Starting the first of the new year, trips to the dentist are no longer paid for under Medicaid. Dental services will be eliminated for all adults except those with developmental disabilities or in the case of an emergency. 50,000 people will be impacted. Also beginning January 1st, people with feet problems will be out of luck. Adult podiatry will no longer be covered unless it's necessary to treat an acute condition. And for people who have hearing problems, hearing aids, cochlear implants, or any other hardware related to hearing will no longer be covered. For adults who have a hard time seeing, Medicaid will no longer pick up the tab for glasses. School-based medical services for special ed students like physical, speech, and occupational therapy will not be funded by the state anymore. Prescription copays that cost $1 to $6.30 will no longer be covered for Medicaid patients who are also eligible for Medicare Part D. 3 other cuts take effect a couple of months down the road on March 1st. The Children's Health Program will be cut. This provides medical insurance to 27,000 children who are primarily undocumented. Also in March, for those who don't speak English, the state will no longer fund interpreters for doctor's visits. And last, Disability, Lifeline, and Alcohol, Drug Treatment and Support Act recipients will be on their own. Medical services won't be covered after February.
At the end of last week, the governor restored several programs that were previously on the chopping block, things like prescription coverage and hospice care. She hopes to restore hearing, dental, and vision programs in the 2011-2013 biennium, but whether or not that's realistic is unknown right now. In the newsroom, Sally Showman, KXLY4 HD News.